Okay. So I think we'll go ahead and get started. Uh, Again, I'm Colin Murphy from the Dassault Systems Benefits team, and Maureen Giggy, my manager she is manager of, or the director of compensation and benefits, is with us today as well. We both had the opportunity of meeting with you last week and to go over benefits as a whole. We're back this week with a more defined focus on specifically the medical plans. So we're going to go through that this afternoon. Again, we are recording this, so if you want to review back to it at a later time, you're certainly welcome to do that. You're also welcome, obviously, to reach out to me at any time if you have questions on a more individual or specific nature. Feel free to do that. There's not a tremendous amount of us on the call today, so please, if as I'm going through the presentation, there's a topic or a subject that we're talking about that you want to go, that you either have questions about or want me to go into more detail, please feel free to stop at any time. Undoubtedly, you may have questions throughout the presentation. Again, feel free to ask me throughout, or again, I expect that we'll have time at the end of the presentation as well. Really, for today, we're going to focus specifically on the medical plans, and so we will walk through, again, the design of each of the three medical plan options that you have available to you. And then I think for most of you, the concept of a high deductible medical plan, or in the case of Dassault Systems, a health investment plan, is a new product or a new medical plan choice that you may not be familiar with. So we will spend a bit more time on that in the latter half of the presentation. And then we'll just go over some reminders and tips, tricks in terms of where you can find additional information, where you can get help, etc. So that's going to be our focus for today. And so we'll really start off, again, with a bit of a review of the three different medical plans that we offer here at Dassault Systems. At Dassault Systems, our insurance provider or the administrator of our plans is Blue Cross of Massachusetts. All three of the medical plans that we offer are through them, the copay plan, the co-insurance plan, and the health investment plan. Again, they have similarities amongst all three plans as well as differences. In terms of those similarities, again, whatever is covered on one plan is covered on the others. The difference is going to be what you pay for those services. The same network of providers. So it's a national network of providers. So whether you're living in Massachusetts or California or somewhere in between, that network of providers is exactly the same, and there are doctors in every state, so you have access to them. Again, if you have children that are away at school, as long as they're in the U.S., you certainly don't have any issue. Again, there would be a Blue Cross provider available to them, and they don't have to be living in your household in order for them to have coverage under your plan. And again, in terms of the routine services, when you're talking about preventive care, going in for your annual physical, getting mammograms, prostate exam, etc., those screenings are covered at 100%, and we encourage our employees to take advantage of that. And again, that's on all three different plans that we do offer. Where the differences occur is what you pay for them out of your paycheck. So we'll go into this in a bit more detail. The copay plan, you pay more from your paycheck, but then at time of service, you're going to have a less variable cost at that time. The deductibles, co-insurance, or copays, they're different on each plan. So those are the types that you'll review and determine which plan is right for you. And then finally, the eligibility for a tax-free savings account. So many of you in CST participated in a flex spending account. That would be your option here at Dassault Systems if you're enrolling in either the copay or insurance plan, or if you're enrolling in our health investment plan, they have access to a health savings account. And we'll describe that plan in more detail because that is new to you. Here, what we're trying to show you is, again, where the plans are the same and where they're different. So when we're looking at these plans, again, all three plans, if you're going in for those well visits, routine physical exams, the diagnostic screenings, there's no cost to you on any one of the three plans. So if primarily all you're using your medical care for is preventive, you don't have medical conditions already, there's a good chance you can make it throughout the year without paying anything for any of your service other than those per pay period deduction. Everything below those is where we start the decision-making process for you. So Again, on our copay plan, you'll see everything that is listed here is just a copay. So when you go to the doctor, you pay a $25 copay, or you see a specialist, it's a $35 copay. Your room is $100. MRIs, CAT scans, $30, and your prescription drugs, they're just copay. So everything that you're paying on the copay plan is a copay. It's aptly named a copay plan because everything that you're paying on that is a copay when you're using in-network services. So it's an easy to understand, easy to administer plan from your perspective or from the individual's perspective. It's designed in essence to be very simple. The coinsurance plan has many features that are very similar, meaning if you're going in for office visits or the emergency room, you're just paying a copay. Similar with your prescription drugs, you're just paying a copay for these services. The difference between the copay and the coinsurance plan lies in this middle area where you're talking about getting an MRI or an X-ray. If you have inpatient hospital stay, in that case, you do have a deductible on the coinsurance plan, and then therefore, once you've reached your deductible, you'd be covered by coinsurance, meaning you'd pay 10% of the cost, the plan pays the other 90%. That leads us to our health investment plan, where the deductible and the coinsurance are the driving plan features. In essence, nothing on the health investment plan is covered by copays. Everything is based on you meeting your deductible. Once you've met your deductible, you're paying your 10% coinsurance for those services until you reach out-of-pocket max. There's just one exception to that, and that's there's a list of preventive medications that do have copays associated with it. Again, it's designed, or the reason why that is the plan does not want preventive medications in essence designed to keep you from having a more serious medical condition. We don't want cost to be a factor in terms of you continuing to take those medications. So that is the one exception, is that preventive medications that do allow you to just pay a copay rather than 100% of the cost of those medications until you reach the deductible, and then after you reach the deductible, paying that coinsurance. Spelling it out a little bit more in terms of what you're paying for or what are you receiving. Again, the copay plan, you pay more at point of service or from your paycheck, and the coinsurance and the health investment plan, you're paying a lower per pay period deduction. You have access to tax savings accounts. The copay and the coinsurance plan give you access to the healthcare FSA, and the health investment plan gives you access to the health savings account. And with that comes a company contribution of either $750 or $1,500. In terms of deductible, we talked about, copay plan has no deductible. The coinsurance plan has a low deductible, $250 per person, up to a maximum of $750 for the family. And again, the health investment plan is what's known as a high deductible health plan, and that's defined by the IRS having a minimum deductible. And in this case, DeSoto Systems sets ours at the IRS minimum, and that's $1,350 for employee-only coverage or $2,700 for family coverage. All free plans, and really all plans nationwide at this point, have what's called an out-of-pocket maximum. And that covers your medical and your prescription drug expenses so that you know going into the plan year what is your worst case scenario. So again, the copay plan has a $1,600 or $4,800 out-of-pocket max. It's $1,600 per person. So if you're covering 3 people, each person would have to hit their own $1,600 out-of-pocket max in order to reach that $4,800. The coinsurance plan acts identically. $1,600 out-of-pocket max for an individual to a maximum of $4,800 for a family. So each person has a set $1,600 out-of-pocket max until you reach that $4,800. The health investment plan does act, again, a little bit differently. It has a $2,600 employee-only out-of-pocket maximum and a $5,200 family out-of-pocket maximum. The difference here is if you're signing up for individual coverage or employee-only coverage, that $2,600 is your out-of-pocket maximum. That's your worst-case scenario. With the family coverage, again, that's employee plus spouse, employee plus children, or family coverage. You have a $5,200 family out-of-pocket maximum. One person in your family can hit that $5,200, meaning they've just incurred a significant amount of claims in 1 year, or some combination of all family members. But in essence, that $5,200 can be reached by one individual or the combination of anyone. In terms of what you pay for these coverages, and just in essence to have the medical coverage, you're going to be paying one of these amounts from your paycheck based on what coverage you're signing up for and what tier, meaning employee only, employee plus spouse, employee plus children or family. These are deducted from your paycheck on a pre-tax basis. So again, with CST, you had a deduction from your paycheck for medical. This would be similar. I think you'll find that these rates are a bit lower than what you were paying previously or currently with CST. I suppose this is just a good place to remind you that your payroll will be switching from monthly to biweekly, so you will get paid every other week going from January 1st onward. I think the first paycheck is January 4th of 2018. Talked a little bit before about your access to different types of tax savings, tax advantage savings accounts. Again, if you're enrolling in either our copay or our co-insurance plan, or technically even if you're not enrolling in one of Dassault Systems Medical's plans, you can sign up for a healthcare flex spending account. If you are signing up for our health investment plan, you'll automatically be enrolled in a health savings account, and that health savings account would automatically start because there would be that company contribution. But again, with the health investment plan, you're automatically enrolled in that health savings account. They have different providers. WageWorks for your FSA, which is actually a partner of your current provider, I think is Choice Strategies. They are a division of WageWorks. For the health investment plan, the health savings account that's managed through Health Equity. The list of services that you can pay for with either a flex spending account or a health savings account are the same, meaning those same types of claims, the out-of-pocket expenses that you have from a medical, dental, vision, or prescription drug expenses, those are the same on both plans, and you can find a list of what those are. I think obviously if you had one of these accounts, a flex spending account before, you're quite familiar with the types of claims that you can submit for them. But really those out-of-pocket expenses, whether that's the co-pays or the co-insurance you're paying, your prescription drug co-pays, et cetera, those are things that you can pay from your health savings account or a flex spending account. The IRS just finalized the rates for the maximum that you can contribute to an FSA. It's $2,650, whereas you can see on the HSA side, you can contribute quite a bit more, either $3,450 for individual coverage or $6,900 for a family. And it also does provide, if any of you are age 55 or older, the ability to do a catch-up contribution similar to what you might do with your 401k. So again, it's an opportunity, again, to put away money tax-free, whereas you don't have that option in many other places. Key difference here is the flex spending account. It's a use it or lose it program, meaning if you elect to put in $2,650 into your flex spending account for 2018, you have to incur expenses for that $2,650 in order to get reimbursed. If you don't have claims to match up with that $2,650, whatever you don't have claims for, you lose at the end of the year. Whereas on the health savings account, you put those funds in, you can use them either in 2018 or any year beyond that. So you'll never lose those funds in your health savings account. The flex spending account have only during open enrollment, or if you have a qualifying event during the year. Those are when you have an opportunity to make a change to your flex spending account election, meaning during open enrollment, you're going to pick a number if you want to. If you want a flex spending account, you'll pick the amount that you want withheld for the year, and then you're stuck with that really for 2018. On the health savings account, you can adjust that contribution anytime that you want to. So if you start off not putting in any funds and you decide later in the year, hey, this really makes sense, or maybe you have some claims during the course of the year and you want to make sure that they're paid with pre-tax dollars, you can put those funds into your health savings account at that time. In either case, with your, this is a key difference. With the flex spending account, if you have one, you're familiar with this. Say you elect $2,000 in your flex spending account and you have a child getting orthodontia in January, you can get reimbursed for that full $2,000 in January, even though you haven't contributed those funds yet. That's different than on the health savings account. You can only reimburse yourself from your health savings account what's actually in your account. Again, Dassault Systems does make its contribution to your plan with the first payroll of the year. So we do try and help front load your account to some extent. But if you don't have the funds in your account, you can't claim anything above what's in your account. So if your balance is $1,500 and you have a $2,000 claim, you can reimburse, you can make a payment or reimburse yourself up to that $1,500, but you would have to wait until you actually had that additional $500 in order to reimburse the full $2,000. Okay. And then again, whether you sign up for a flex spending account or a health savings account, you will receive a debit card that you can use at point of purchase. So that should be very similar to what you do. With a flex spending account, you do have the ability to file a claim. If you choose not to use your debit card, you can file a claim either through a paper form, which we have on our benefits website, or they have an online option through WageWorks as well. If you're signing up for the health investment plan and you have your HSA, again, you still have that debit card that you can use at point of purchase. You can go into your online account. It's basically like a bank account and pay providers directly through your health savings account, or you can reimburse yourself from your health savings account. There's just an option that you choose to click on and reimburse yourself for those claims that are available. The nice thing with the health savings account is all those claims that you have from a medical, dental, vision, or prescription drug expense perspective, that claim information is sent from the providers to Health Equity. So when you're looking at your account, you can see all of your claims history right there. And again, choose to either pay a provider or reimburse yourself, or again, just hold off and wait to reimburse yourself at some later date because you're using it much more as an investment option. We'll talk about that a bit more in a minute. So again, let's start looking at these three different medical plans in a bit, in I suppose some real life scenarios or examples that we have for you. We'll start with Raj, and Raj is what's known as a low user. He's been in fairly good health, has low expenses, and so we wanted to show you really what it would look like per plan in terms of what his expenses would be. So you can see in Raj's case, pretty much what he does is goes in to see his primary care physician for his annual physical. In this particular year, he had one non-preventive visit. Let's just say he had bronchitis, or he was not feeling well, thought he might have bronchitis or something more serious. So he went to the doctor. They had the doctor's visit. He had some lab work done, and he received a prescription for it. So went and saw one specialist. Okay. So on the copay plan, what you're seeing is he's got no cost for his routine exam. He's paying $25 for that office visit, just a copay. He also had a copay for his prescription drug of $10. The specialist visit has a copay as well, $35, which means his out-of-pocket expenses for the year was $70. We add that to what he had deducted from his paycheck, the $1,542 for the individual coverage, and you can see that his total cost for medical coverage in 2018 would be $1,600. We look next at the co-insurance plan, and really what you're seeing here is, again, he's going to have copays for the office visits and the prescriptions. The big difference here is the lab work. In the case of the lab work, he's got to pay through his deductible. The deductible is $250. In his case, the cost of the lab work was less than that, so he paid the full cost of that bill, the $200, but he still hadn't met his deductible for the year. In his case, he spent $270 for his out-of-pocket expenses, plus the $550 for actually having the co-insurance plan, and that leaves his annual total out-of-pocket expense at $820. Okay. We move to the health investment plan. Again, there's no copays on this plan, so in essence, he's paying the doctor's visit in full. He paid the full $150. Again, these are negotiated rates with Blue Cross, so he is getting a discount over if he had just gone to the doctor on his own without medical insurance. But in his case, again, the doctor's visit was $150. The lab work still $200, just like on the co-insurance plan. He paid the full cost of the medication. So whereas copay in the co-insurance plan, he was just paying a copay. In this case, he paid the full cost of that medication. Plus, he had to pay the full cost of that specialist visit. So again, he didn't meet his deductible for the year. He just continued to pay the full cost for the year. That left him with $613 of out-of-pocket expenses, plus the $550 that he paid to have the health investment plan as insurance. leaves him a total of $1,163 that he spent on medical services during the year, or medical insurance and coverage. The one piece here to consider, though, is, again, Dassault Systems made a contribution to his health savings account. Whereas the total cost was $1,163, his out-of-pocket was $613. So he could have paid all of those expenses with the money that Dassault Systems gave him. So in essence, his out-of-pocket expense really could have been solely just the company, the per pay period deductions adding up to the $550 for the year. Does that make sense for everyone? Okay. We'll move on to a more moderate in terms of usage of medical expenses. We won't go into quite the same level of detail, but again, in this case, it's Susan, and she's got family coverage. And in her case, they did have some services during the course of the year. You can see, again, on the copay and the co-insurance plan, they had those prescription medications. They had the diagnostic office visits where she's just paying copays for all those services. A difference here where, again, x-rays and labs are covered at 100% on the copay plan. On the co-insurance plan, she did have to pay her full deductible plus another 10% or $20. So you can see the out-of-pocket difference here. Paying more out of pocket, but then when you take into account the paycheck contributions, it's certainly a lower cost on the co-insurance plan versus the copay plan. When we look at the health investment plan, again, paying full cost for all of these different services, didn't reach the out-of-pocket max, the deductible limit of $2,700. So she had the out-of-pocket expense plus the paychecks for that total cost to her of $4,207. And again, Dassault Systems made that contribution of $1,500 that could help cover the expense. So she would, in essence, have about $360 of her own money that she would had to have paid out in 2018. We also wanted to take a look at somebody that's a high user, in this case, on both the co-insurance and the health investment plan. This family, or this employee plus spouse coverage, they reached their out-of-pocket maximum. So again, they had a number of office visits, some prescription drugs. They actually, both he and his wife had to have inpatient surgeries. So they racked up quite a bit of expenses during the course of the year. You'll see, again, on the copay plan, it was very simple. They had just the copays for all of their services added up to $800 out of their pocket. On the co-insurance plan, they had some copays for the office visits and the medications, but then they also had the inpatient hospital stay that resulted in them, in essence, reaching their out-of-pocket max, the $1,600 out-of-pocket max for both Dan and his wife. So they had a worst-case year. They hit their $3,200 out-of-pocket max for the year. Combine that with their per pay period, or their paycheck contributions, and you can see their total. And then again, on the health investment plan, due to the large cost of their expenses, they ended up reaching their out-of-pocket max too of the $5,200. So their out-of-pocket cost, both from a payroll perspective as well as the claims, they ended up at $6,800. And again, one thing to consider is that company contribution to the HSA, which provided that additional $1,500. So again, their out-of-pocket expense could have been around $5,300 based on the company contribution to their HSA. We took Dan's scenario one step further and took into account if they did participate in some sort of tax savings tool, whether it's the flex spending account or the health savings account. So the top part here, we just carried over from the previous slide. We looked at their total cost out of pocket, the claims, plus the payroll deductions. And we also took into account their participation in an FSA or an HSA. So again, with the copay or the co-insurance plan, we took a presumption of, let's say they were expecting some of these costs, so they put in half of their known expenses and they put those into a flex spending account. flex spending accounts and the health savings account, we assumed a tax savings rate of about 35%. Again, you're saving on federal, state, and FICA taxes on these in most states. California, I do want to point out, is one that, from a state perspective, they don't allow state tax to be pre-tax for the state of California. But again, it does, in essence, bring down that net total that they would expect to spend by taking advantage of these tax savings accounts. And you can see, really, for Dan, regardless of which plan he had signed up for, that net cost, when you take into account the tax savings and the company contribution to an HSA, it really is providing him a worst case scenario year. That total cost to him, to he and his wife, comes out really about even amongst all three plans. Here we're going to move into perhaps a deeper dive specifically on the health investment plan. But I suppose before I do that, does anyone have any questions about the copay or the co-insurance plan before we spend a bit more time on the health investment plan?
Colin, I'd like to ask about this maximum out-of-pocket for the family plan on the health investment.
Okay.
That is what it sounds like, right? You just get to your cap of $5,200, I think it says there, for the family plan.
Mm-hmm.
And that's that. If you need, continued care, you're hospitalized or whatever else, that is being 100% picked up by the plan at that point?
That's correct. And that's for all three plans. Each plan has its own out-of-pocket maximum, but once you and your family have reached your out-of-pocket maximum for the year, you wouldn't have any more expenses from a medical or a prescription drug expense for the remainder of that calendar year.
And for the family plan, the out-of-pocket maximum is, there's an individual portion of that, correct? Or am I missing that on there?
No, specifically on the health investment plan?
Yes.
Right. On the health investment plan, it's one person or any combination of family members can hit that out-of-pocket maximum. That's a little bit different than the other two plans where, in essence, the out-of-pocket max looks at each person individually. One person could hit their out-of-pocket max on the co-insurance plan or the copay plan, and they're capped at $1,600, meaning the plan pays everything else for them for that calendar year, but other family members could still incur expenses until they reach their individual out-of-pocket maximum.
Okay.
On the health investment plan, it's looking at your family as a total. So whether it's one person hitting that $5,200 or any combination of people in your family hitting that $5,200, I guess that's the big difference is one person could have significant claims in one year and be responsible for that full deductible as well as the full out-of-pocket max.
Thank you.
Colin, so I had a question. Regarding the so if the out-of-pocket maximum for individual is $2,600 and the HSA contribution is can be up to $2,600, so if you put in $2,600, does that mean into HSA? Does that mean your out-of-pocket maximum can be reached using the HSA?
So the HSA is a savings account. So yes, I mean you can put in enough money and more actually than your out-of-pocket maximum. That's true. The health savings account is in essence a bank account with tax-free dollars in it that can be used to pay your out-of-pocket expenses. So it's not automatically paying your expenses. It's an account that you can then pay those expenses with. Does that make sense?
Yes.
Okay. But yes, I mean, in the case of the health investment plan, you do have the ability with that health savings account to put in more money than your out-of-pocket maximum would be. So if you're signing up for employee-only coverage, your out-of-pocket max is $2,600. I think $3,400 is the max you can put into your health savings account, and that's company contribution plus the employee contribution. For the family coverage, and that would be employee plus spouse, employee plus children, or family coverage itself. The maximum is $6,900 that you can put into the health savings account. And again, your worst case scenario from a medical and prescription drug perspective is $5,200. The nice thing with that, meaning the fact that the health savings account allows you to put even more money in, is that you can also use that health savings account for dental or vision expenses that you're incurring out of pocket. So the health savings account is tied specifically to the health investment plan, but the the expense that you incur from a dental and vision perspective can also be used to be, or can be reimbursed from that health savings account.
Okay, thank you.
This is Frank speaking. Could you just clarify again? So for the 6,900, the 1,500 that the company gives, does that go on top of that, or is that included? So can I actually contribute the full 6,900, or 6,900 minus? Okay, right. There we go.
Right. So the IRS sets the limit, just like, well, I guess it is different than a 401k. The 401k, you can contribute up to 18,000, or I think in 2018 it's increasing to 18,500, and the company contribution is above and beyond that. In this case, that IRS cap is inclusive of both employee and employer contributions. So from an employee contribution perspective, you're going to be limited to a max of $2,700 if you're signing up for individual coverage, or $5,400 if you're signing up for family coverage. And then just to make it a bit more confusing, or adding more detail, if any of you are age 55 or older, there's a catch-up contribution of an additional $1,000. So you could contribute either $3,700 or $6,400 if you're age 55 or older. Any questions? Okay, now let's go ahead and we'll jump into, I suppose, a deeper dive into the health investment plan. And we'll start with really, I suppose, more of a definition of healthcare consumerism, and that's really the driving factor behind high deductible health plans. Probably since about the early 2000s is when high deductible health plans began, and really in the last 5 or 6 years they've started to take hold, and really the IRS has been working to make it more and more attractive in terms of that tax savings feature with the health savings account. But basically the healthcare, the high deductible plans and the healthcare consumerism is focusing on 4 things: promoting good health, so making sure that those preventative services are available at no cost to you, reinforcing healthy behaviors through the health plan cost structure is really about taking advantage of the preventive services so that you're trying to avoid those big ticket items. So Dassault Systems has that philosophy really in general. When you look at our medical plans, our dental, vision, etc., you're looking at plans where we're covering the cost of those preventive services. We want you to go and get your annual physical. We want you to get your teeth cleaned semi-annually. We want you to get your eyes examined on an annual basis. The reason for that is certainly it's going to identify for your doctor any issues that you may be having, or areas that may be of a concern, so you can address them sooner. The sooner you're addressing them, the lower that cost will be to you and to Dassault Systems for that matter. But really keeping you healthy is better than fixing a problem. So having that as the core component is important, and we think it's important, and that's why we make sure that it's not a barrier to you to have any of these preventive type services. Quality care, I think there's a lot of times when people think of the higher the cost, the better the coverage. The reality is that's not necessarily always the case. So helping employees to become consumers, so that really ties in with the second one, or the third, the understanding the cost of care. Becoming a better consumer allows you to identify, again, in the Blue Cross system, or if you go to Blue Cross website, you can find how they identify doctors in terms of high quality, low cost providers. So you're starting to become a consumer. You're choosing, say, an MRI. An MRI is going to be the same service. It's the same machine regardless of where you go. So you can pay $800 at one location, or you can pay $1,600 for that same MRI service. It really just comes down to what that provider is charging. Helping employees become better consumers puts more money in your pocket, puts more money in the company's pocket, and obviously you're seeing that from the perspective of what the premiums that you pay out of your paycheck are. The more educated employees become in terms of how to become consumers, the better the program works and the lower the cost of healthcare in general is. And again, really the last feature here is the enable savings for future costs. Consumerism or high deductible health plans are really designed to not just think about your healthcare in 2018. You are making a decision for 2018 when you're choosing your health plan, but it's also about thinking the long run. Somebody had asked a question earlier about trying to cover their out-of-pocket max with their health savings account, and the fact that there's even additional funds beyond that that can go into that health savings account. So even if you had your worst case scenario, $5,200 a year out of pocket, you still had money put aside that would roll over into 2019 or 2020 and beyond. So building up an account, not just thinking about what your healthcare needs are for 2018, it's thinking about how can I save for my healthcare expenses in retirement, as an example, or I'm putting away money into this now so that I can use it anytime in the future. The nice thing about that health savings account is you're able to, in essence, build up an account for whatever you're interested in. For some people, you may be able to build up that health savings account to the point where you're reaching that out-of-pocket max concern that you're wanting to protect your finances from. And then you may not contribute to an HSA in the future because you've met that, and you're basically making sure that you stay at that level so that you're protecting future years of your worst case out-of-pocket expense. So it gives you that flexibility to do that, whereas, again, the previous examples, or what was made available previously, like a flex spending account, really was just looking at a one-year period of time. So what is the health investment plan? Again, we've pointed this out a few times. It's a PPO plan, which is a preferred provider organization. It's the same as our copay and the coinsurance plan in terms of your network of doctors is exactly the same. So you're not you're not choosing this plan or not choosing this plan based on who you can go to. There's no limitations on that other than just the national network of Blue Cross providers. But it's also a long-term financial savings vehicle that you can use for healthcare. So that health savings account component acts much like a 401k from the perspective of it's a tool that you're using to build for a long-term financial success. Health investment plan has to meet the IRS guidelines of that minimum deductible, which again is a high deductible, the $1,350 or the $2,700. And what does it offer? It offers you, or why do we offer it? We offer it for a few reasons. One is we want to make sure that we're offering choice to our employees. You can see from the three plans that we offer, each one has a different component that may be attractive to you or may be unattractive to you. We want to make sure that for all of our employees, we're providing a difference, a comparable difference that makes one choice potentially work best for you and your family. The other reality is Dassault Systems acquires companies, I don't want to say frequently, but there are many times, just like CST, that Dassault Systems has acquired a company. In some of those cases, these companies have come in with a high deductible health plan with health savings account. Those employees really enjoyed that through their previous employer. They liked the idea of building that long-term financial safety net in their health savings account and wanted to continue that with Dassault Systems. So we wanted to make sure that was available. And like I said before, making sure that you have choice, that we're providing options that amongst our three options, we think that there's going to be a right plan that works best for you and your family. So again, with the health investment plan, we've talked about all of this before. The core components of it is there's a deductible. We've talked about that $1,350 or $2,700 deductible that you are responsible for paying 100% of the cost of. And once you reach that, then you're covered at coinsurance, meaning you're paying 10% of the cost. Dassault Systems is paying 90%. And I do mean Dassault Systems is paying that. Blue Cross administers our plan, but Dassault Systems is fully responsible for paying those claims that you and your family incur. In terms of, and that continues, so you'll continue paying that coinsurance for any non-preventive medical appointments as well as prescription drugs until you've reached your out-of-pocket maximum. That out-of-pocket maximum is basically that cap or your worst case scenario of $2,600 for an individual or $5,200 for a family. And how you can pay for those is through your health savings account. You are absolutely welcome to pay for any of your claims out of pocket. The health savings account is just a tool that the company contributes to, either that $750 or the $1,500. But it's an opportunity for you to have tax-free funds to pay for those medical expenses. Now, how does the HSA work? Basically, from your paycheck, you can contribute money pre-tax. So again, federal, state, and FICA taxes, except for California, and I believe New Jersey is the other one, where state taxes are still withheld, but federal and FICA taxes would still be available to you. You're able to put those money in up to the IRS maximum. At time of service, you have a claim. You can choose one of two things. You can either reimburse yourself or pay a provider directly from your health savings account, or you can pay for those services out of your own pocket, meaning use your own credit card, pay for the service, get the points on your credit card, and then at some point in the future, reimburse yourself for those funds. That claim is sitting out there ready to reimburse you at any point, but whether you reimburse yourself in 2018 or you decide to let that claim sit out there for 20 years and then go back and reimburse yourself for it, that's perfectly acceptable. Part of the beauty of the health savings account is the fact that it does have an investment option with it. So when your funds hit $2,000 in your health savings account, you can start investing just like you do with your 401k fund. There are different mutual fund investment options, both stock mutual funds, bond mutual funds, money market, etc., that you can invest and really have your money, in essence, work for you to grow, so that not only is it what you put in, but there's growth potential with that as well. And again, the nice other feature is once you put that money in, you don't have a fear of losing it. The money that you put in, the money that the company puts in, always belongs to you. So if you leave Dassault Systems, if you retire, no matter what, or just whatever, or you decide not to enroll in the health investment plan in 2019 or some year beyond that, that money still belongs to you. It is your account. It's in your name. You have access to those funds to pay for any type of medical, dental, vision, or prescription drug expenses that you incur from the time that that account is set up onward. Again, whether you're still with Dassault Systems or not. So just, I do want to reiterate that investment feature. Again, you have the ability to put in the money. You have the decision as to when that money comes out of your HSA account. So you can, if you're incurring expenses during the year and it's more than you want to spend, meaning out of your own pocket, you can use those HSA funds at that time, or leave it in your account, pay for those expenses out of pocket, and reimburse yourself sometime in the future for those, but allow that money to grow just like you are with your 401k account. Somebody asked a question earlier about how much you can contribute, so we've already covered this to some extent. Again, the company is making its contribution. That goes in with the first payroll of the year. You have the opportunity to put in any amount from $0 up to the $2,700 or the $5,400 pre-tax out of your paycheck. That's just divided out over the number of pay periods in the year. And you can adjust that throughout the year. So if you start off not contributing to the HSA, that's okay. You can switch and start adding to your HSA in February or April or July or December for that matter. You can start contributing to your account at any time. Or similarly, if you start off the year and you've put in, let's say you've put in $600. So you've got $600 of your own money, $750 from the company. You've met your individual deductible, and you say, you know what, I'm good. If anything happens, any claims that I'm incurring after this, I'm only going to be responsible for 10% of it. So I'm good. I'm just going to stop contributing to my plan for the rest of the year. You can do that as well. But basically, whatever you've set your contributions to, that's just going to divide out over the course of the remaining pay periods in the year. So you have a lot of flexibility in terms of how you manage it, just like you will with your 401k plan. There's other things to think about, and we've talked about some of these, whether it was last week or earlier today. When you are enrolled in the health investment plan, you have access to an HSA. You cannot be enrolled in another medical plan. So if perhaps you're enrolled in the medical plan here at Dassault Systems or with CST, and your spouse also had coverage and you had double coverage, so meaning you just wanted to be extremely insured from a medical perspective, you cannot have another medical plan when you're contributing to an HSA. So if you are double insured and you are wanting to enroll in the health investment plan, you'll want to make sure that you cancel that second coverage. Again, the CST coverage will automatically cancel as of December 31st. The other key piece is you can't have an active healthcare FSA, so you can't be contributing to an FSA anymore from January 1st on when you're participating in a high deductible plan. You're in essence choosing the health savings account over the flex spending account going forward, or at least for that calendar year, the year that you're enrolled with the high deduct or the health investment plan. You can't use your HSA to pay for the premiums coming out of your paycheck. The reality is those are already coming out of your paycheck with pre-tax dollars, so you can't do it twice. Now that said, if you're thinking about your HSA funds for the long term, you can use your HSA funds to pay for things like long-term care insurance or COBRA premiums. If you left Dassault Systems and you were continuing coverage through COBRA, you can pay those premiums with your HSA account. Or if you're thinking really long-term, when you're in retirement, you're on Medicare, there are Medicare supplements, you can pay those premiums for the Medicare supplements with the HSA dollars. If you left Dassault Systems and it's your account at Health Equity, it's in your name, you may have to pay administrative fees if your balance is below $2,500. They do have a monthly fee, and I believe it's $3.95 per month. While you're with Dassault Systems, we're paying that, or I should say while you have a health investment plan and the HSA associated with it, Dassault Systems pays that. If you decide not to participate in the HSA or the health investment plan in future years, if your balance is below $2,500, you would have a $3.95 monthly administrative fee with Health Equity. If you change your mind, like I said, and in future years you decide not to participate in the health investment plan, you can still use the funds that are in your health savings account. So to pay for, let's say, the copays on the copay plan, you can still use the funds in it. You just can't add anything else to your health savings account without being enrolled in our health investment plan or in general with a high deductible health plan. This one is a key one I want to make sure everybody is paying attention to. You can cover your dependents, spouse, domestic partner, children on your medical plan. But if they are not your tax dependent, you can't use the HSA funds to pay for their medical expenses. Meaning, if you've got a child that is out working on their own, filing their own tax return, and they are no longer your tax dependent, they can be covered on your medical plan, but you could not use your HSA funds to pay for them. Similarly, if you have a domestic partner and they're not your tax dependent, you can cover them on your medical plan, but you wouldn't be able to use the HSA account to pay for their expenses. And the last one here is we have chosen, as Dassault Systems, we've chosen to work with Health Equity. And like I said, we'll automatically put in an employer contribution to your HSA account. If you don't like Health Equity, or you choose, you've got a health savings account with somebody else and you just prefer them, you are absolutely welcome to continue to use them and perhaps even put in your funds, your employee contributions to your any contributions that you wanted to make to a health savings account. You are welcome to do that with that other provider, but please note that you would still have the Health Equity account that would have the employer contributions that we've made, and then again, if there are any administrative fees with that other provider, you would be responsible for those. So I did want to walk through quickly, and I know I'm running long, and we'll just try and work through these scenarios specifically related to the health investment plan. So again, these won't have the comparison with the copay and the coinsurance plan. This is really just looking at how Steve, Julia, and Puneet are dealing with their claims on the health investment plan. So our first scenario is Steve. Steve is a relatively healthy person. In essence, in year one, he had no claims. All he did was get his preventive care services. The company made its contribution. His HSA at the end of the year was $750. He didn't make any contributions on his own. He just received the HSA contribution from Dassault Systems, and that's what his HSA balance is at the end of the year. In year 2, he had some additional services. He ended up deciding to make a contribution on his own. He wanted to start building up his account. He had some services during the year, 2 lower cost. He had an office visit and a prescription, but then he also had $300 worth of dental work. And he decided $300 was more than he really wanted to pay out of his own pocket. He had the funds in his HSA account, so he reimbursed the provider. He paid the provider from his health savings account. So by the end of year 2, with his $1,000 contribution, the $452 worth of claims that he had, but the $300 that he reimbursed from his HSA, he had $2,200 available still in his HSA after year 2. Now again, he still had $152 from the office visit and the prescription. At any point in the future, he can go back and reimburse himself for that. He's just decided to allow his account balance to grow and be invested at this point. In year 3, he gets married, and his wife has decided to get a new pair of glasses, but otherwise they had no out-of-pocket expenses. So he's married now, so that employer contribution increased from $750 to the $1,500 for year 3. He contributed more money because he's really starting to understand the idea of building up that account balance. He had the $250 expense for his wife's new glasses, and he decided to reimburse himself for that. So again, by the end of year 3, with $3,000 worth of contributions on his part, but the company contribution as well, at this point he's built his account up to $5,450. So it's really that idea of continuing to build up that account over time. Our next example is, and by the way, I'm seeing a note here from Tracy. I don't know. Okay. Tracy, if you do have an issue or wanted to ask a question, let me know. Our next example is Julia. Julia has individual coverage, and in her case, really healthy year 1, had a more significant expense in year 2. So again, year 1, she's got the employer contribution. She made some contributions on her own, basically just to make sure that she was covering that deductible. So she's got a total of $1,350 in her account. She only wanted to make sure she had that to cover we'll say the large expense, that 100% through the deductible portion. And then she really didn't have any expenses. She just had her preventive services and didn't have any other needs. So she didn't have any out-of-pocket expenses year 1. Year 2, she got in a biking accident and incurred a lot of expense. The claims total, or I'm sorry, the cost for services came out to $35,000. So in year 2, she actually hit her out-of-pocket maximum, the $2,600. She had, again, $1,350 in her account going into year 2. The company added in $750, so she had a total of $2,100 in her account. As you can see, her claims expense was greater than that. It was $2,600. She reimbursed herself the full $2,100 that she had in her account. So at the end of year 2, she had no money left, and she had to pay $500 out of her pocket for those expenses because she just didn't have the funds in her account to pay for them. Okay. In year 3, back to, we'll say, her normal year, she had minor expenses, but she also said, hey, I really need to start building up my HSA account. So she made it that she's received the company contribution. She added in $2,000 of her own money. She had $250 worth of expenses in year 3. So in year 3, now that she's put in the $2,000 plus $750 from the company, she reimbursed herself from year 2, that $500 that she had to pay out of pocket. Plus, she was able to reimburse herself for the $250 for the medical and dental expenses she incurred in year 3. So again, the company contribution in and of itself were enough to cover that cost. And at the end of the year, rolling into year 4, she had $2,000 available to her. Our last example is Puneet. Puneet is covering he and his wife, and they are coming up to the end of his employment. He is considering retiring, and he is really thinking about the HSA contributions as long-term. He really wants to build up his account, not only for any an expected major expense for knee surgery that's coming up, but also he just really wants to have that money available in retirement. The good news for Puneet is clearly he had the financial ability. He had cash on hand to pay for some more significant expenses in years 1 and 2, where he paid those out of pocket. So again, in year 1, you can see he put in, or the company put in $1,500. He's over 55. He put in not only the employee contribution of $5,400, but he was able to do the catch-up contribution as well. So he had the $6,400 go in. He had $3,150 worth of expenses in year 1, but he opted not to use any of his HSA funds to pay for that. He paid it all out of pocket. At any point in the future, he may reimburse himself for that. But right now, he's really focusing on the investment aspect of it. So at the end of the year, he still has $7,900 in his account that at any point he can go back and reimburse himself for those $3,150 worth of expenses. Year 2, same scenario. He's got medical expenses in the neighborhood of $2,900, but he's focused solely on adding to his account, adding to his account, adding to his account, and at some point later in the future, he'll reimburse himself for that. Right now, he's capable of paying those expenses out of his pocket. And then finally, in year 3, he is really close to retirement, and he says, you know what, Dassault Systems has great benefits. I know that the cost of knee surgery through Dassault Systems is going to be better than what I may have on Medicare. So he opts, I'm going to get this knee surgery knocked out before I leave, before I retire. So he does that. In this particular case, this is really what the big expense that he's been sort of wanting to avoid, or knowing that he wanted to have funds available for. So not only does he have the expense, but he reimburses himself that $5,200, that out-of-pocket maximum that he incurred in year 3. But again, he still is able to walk away not only with still building his account, not including any type of gains or losses from those investments. So again, he has the ability to still go back after year 3 or after year 4, etc., to reimburse himself for these claims he incurred in years 1 and 2. He just has opted not to. From a financial perspective, he was well off enough that wasn't important to him. It was really more about building his account for the long run to have those tax-free dollars.
Colin, just a quick question.
Mm-hmm.
So you said they can actually reimburse the expenses from a past medical bill, right? So is there a limit on how far I can go behind?
The only limit is to when you first began participating in a high deductible health plan. So in your case, this will be, I expect, if you're signing up for it, this will be 2018. January 1st, 2018 will be the first year that you have claims that would be eligible for reimbursement through your health savings account. So from January 1st, 2018 onward, you can reimburse any claims that you incur. You would not be able to reimburse claims that you incurred in 2017 or 2016 from your health savings account. It would only be from when you're first eligible for that health savings account.
Okay, thank you. But
I suppose on the flip side, just so that we're clear, if you incur the claim in 2018 and you wanted to reimburse yourself in 2035, you would be welcome to do that. Your claim information is going to be sitting in that health equity system, available for you to identify and say, yes, I'm ready to reimburse myself for that claim now. We just have a few more slides, and then again, we can open it up to any questions that anyone has. We do have a medical plan cost estimator. It is now available. It actually became live as of yesterday afternoon. The medical plan cost estimator can be accessed through rewards@3ds.com. We have an open enrollment portal out there. You can access, review the information that's out there. More information will be added over the next week, just to really try and help all of our employees, not just CST, but all Dassault Systems employees make the right or make the best selections for them for 2018. So I'll go to that site in just a second. But again, that medical plan cost estimator is really designed to help you estimate what your expenses may be, or in essence, you're going to be estimating, plugging that information into the tool to help you figure out which medical plan may be right for you, how much you may want to be putting into your flex spending account or into the HSA account. Again, because that the medical plan cost estimator is designed to give you some idea of what your expenses would be, not just from the payroll, but also from a claims perspective for the copay, the coinsurance, and the health investment plan to help you make that decision. In terms of what's next, again, rewards at 3ds.com. The website is open. It's available now. There's an open enrollment portal you can access. There's a benefits fair for any of you that are, I guess, probably primarily in Framingham, in the Waltham campus next week if you want to drive over. It's next Tuesday. It's from 11 a.m. to 2 p.m. We have vendors that will be on site answering any questions. Maureen and some of my other colleagues on the benefits team, Linda Fifield and Carly Rosenfeld, will be there as well. So you can ask any questions to them as well, certainly to the vendors as well as to the benefits team. Beginning October 30th, that's open enrollment. So you'll have access to the website to make your elections or call our call center to make your elections over the phone. And that runs through November 10th. So from October 30th to November 10th, that's really your time period to not only make these decisions, but make those elections as well so that we know what benefits you want for 2018. On the last call, we talked about there are going to be various forms and documents that the CST population will need to review and sign, and you have from then until I think it's December 8th to return those forms. We have a 401k presentation. I know we've touched on the 401k briefly on our call last Friday, but we'll have an in-depth presentation led by our financial advisor at Arthur J. Gallagher. His name is Kendall Storch. He'll be presenting. I think he will be also on site in Framingham on December 1st for that presentation. And that presentation as well will be recorded like this one is. Your access to the Fidelity site should happen, really is going to be mid to late November. You'll be able to log into that account and start looking at investment options. But again, you may want to wait until after that presentation by Kendall to go and start making elections. But certainly if you are comfortable making your own decisions and know what you want to do with your 401k, I expect by mid to late November you'll have access to that. Again, you'll make your elections by November 10th, and that means that you'll have your ID cards, and you'll receive ID cards from Blue Cross for medical, Express Scripts for your prescription drugs, as well as Delta Dental for dental insurance. You'll have those by January 1st. VSP is our vision provider. They have a generic ID card, and that's available anytime on our rewards at 3ds.com site. Your benefits begin January 1st, so as of December 31st, you would still be using your current provider, the current claims process for any of that, but any services you have after January 1st, you'll begin using those new ID cards and the new claims process. And then lastly, we talked about, I think even in this presentation briefly, payroll switches over from monthly to biweekly on January 4th. That'll be your first pay period. In that case, it'll just be a 1 week payroll that you receive at that point. But then every other Thursday following January 4th, you'll receive that biweekly payroll. When you have questions during open enrollment, so again from October 30th onward, you can call the DS Benefits Center. They're available to answer any questions you have about enrolling. If you're having any issues with the enrollment tool, you can contact them. Certainly you can also email them as well, or you can again make your elections over the phone with a 3DS Benefits Service Center representative. If you have specific questions about benefits, meaning not about enrolling, but specifically trying to figure out or trying to understand a benefit, you can contact the People Support Center. You are also welcome to contact me at any point as well. So I know I've talked to a few people from CST already that had some specific questions. Reach out to me at any time and I'm happy to help. And then if you are considering the health investment plan, we have a health investment plan overview document. It'll be posted on the rewards at 3ds.com site. If not already, then shortly. It should be out there by end of day today. And while we're there, I do want to just point out the rewards at 3ds.com site. Hopefully some of you have come out to the site already. You can see there are 3 tabs here. They rotate through. There's an open enrollment piece, just generic, welcome to Dassault Systems, welcome to our benefits website. So that just is for any and all information. And then we actually have a webinar series going on right now, Pathway to Wellness, that we've hosted webinars over the past 4 or 5 months at this point from a number of vendors. Those tiles rotate, but if you just wanted to click on the open enrollment section, click Learn More, there's now an open enrollment portal. It has some information on here. The enrollment checklist really help you try and figure out what to do. There's an open enrollment newsletter that went to the rest of the Dassault Systems employees. I know we created a separate one specifically for CST, but you're welcome to review the open enrollment newsletter. It's, I suppose, focused a bit more on changes, but everything was changing for you also. So we did a different newsletter for you. And then, like I mentioned, the medical plan cost estimator. There are going to be additional items added to this over the course of the next few days as they become available. So this really is going to be the place that you'll want to go to find out any information about the 2018 plan year. That concludes what I had to talk about, but if anybody has questions, I know I've gone a few minutes long, but if you have questions, please let me know. We can answer them now, or again, you can certainly reach out to me at a more convenient time for you.
For the FSA plan in the new year, is there like a minimum contribution that's required from the employee?
It's $100 is the minimum annual contribution.
Okay, and that's available from the time I start electing it, right?
Correct. Right, so that would be, again, it would be a January 1 through December 31 plan year.
Mm-hmm.
Hi, Colin. I have a question on the co-insurance plan.
Mm-hmm.
For the co-insurance plan, say those co-pays, 25, 35, the co-pays, does that apply to the deductible?
No, co-pays do not apply to the deductible, but they do apply to the out-of-pocket maximum. So again, the deductible on the co-pay plan, or on the co-insurance $250, that only applies to things that there would be co-insurance for. So things like the MRIs, CAT scans, X-rays, hospital inpatient stay or outpatient surgery. Those are the things that have a co-insurance. That's the only thing that the deductible applies to. Once you've reached that deductible, then you're paying the co-insurance. The co-pays and the co-insurance are what apply to the out-of-pocket maximum.
Okay, thanks.
Any other questions?
Yeah, I was wondering, I'm sorry if I missed this, but can I have a DCA account with an HSA, or is that only with the FSA?
You're referring to a dependent care flex spending account?
Yes.
Yes, you can, regardless of which medical plan you're signing up for, or even if you're not signing up for a medical plan, you can sign up for a dependent care flex spending account.
Okay, great. Thank you.
So I have a question for the HSA. Can you say a little bit about the investment options in there?
Sure. I mean, just generically, they are mutual fund investments. So similar to what you are likely familiar with your 401k, there will be some stock mutual funds, some bond mutual funds, and some money market mutual funds. So depending on your level of risk tolerance, that's what would be available. And they have different investment choices available to you. So again, if you're looking for large cap stock investments, they have that as an option, or mid cap or small cap or international, etc. So they have a wide variety of investment options. I know out on our website there's a list of the investment options as well.
Okay, thank you.
You're welcome.
So this is Frank again. So you said we can reimburse ourselves at any time. So I can put in any kind of money now, and I pay $5,000, let's say, out of pocket this year or next year when I'm eligible, and then in 30 years, I can basically reimburse myself for the $5,000 from the interest that my money has made.
Well, you'll reimburse yourself. Oh, you're saying you could reimburse yourself from the interest? Absolutely. So, I mean, I'll tell you what I'm doing is, in essence, I've got 3 kids, and I'm going to have to put them through college. I am paying all of my claims out of pocket, and I've been in this plan since 2014. So
Right.
the claims that I've incurred in 2014, 15, 16, 17, et cetera, I think my first kid will go to college in about 6 years. I've paid all of those out of pocket. I've got all of the claims available, and my intent is when that first one goes to college, I will pull out all of those claims and I should say I'm also maxing out the contribution that I can make to the HSA. So I think at this point I've got about $9,000 or so worth of claims since 2014. I plan to reimburse all of that to help pay for college, whether it's for the first child or one of the children down the road. So that's been my intent. But again, people are thinking of it from different perspectives. We absolutely have people that think of it from much like an FSA, where they're paying all of their claims out of it in the year that they're incurring it. We have other people that aren't touching it at all, are truly using it as a savings plan. And again, they're in a financial position where they can do so. And so they're really looking at how big can I build this account. The reality is Fidelity is saying that a person retiring in this year is going to incur about $265,000 worth of expenses, medical expenses, between the time they retire and death, and that would be for the couple, an employee plus their spouse. So you can pay for that with your 401k, but with your 401k, you're paying taxes either when you put the money in or when you take it out. The health savings account, the more you can build it up, again, if you can build it up to have $265,000 in it, fantastic. You're going to be able to pay all of those expenses from the time that you retire through the end of life with tax-free money. So that's how some people are looking at it, is really truly a savings account. They're already maxing out their 401k. This is an even better investment choice from terms of a tax perspective. So they're truly building up their account, are not reimbursing anything, and looking at it from the investment perspective, or really that building that investment for whether it's long-term or retirement based.
Thank you.
Right. Colin, it's Maureen. Just to add another dimension to that is you can't use your HSA now to pay, for instance, your contributions towards the DS coverage. But in retirement, if you were to buy a supplemental plan to Medicare, you could use the funds in your HSA to pay the premiums on that supplemental plan. So it's not only healthcare expenses you might incur for services, but you can also use the money to pay premiums on supplemental healthcare plans in retirement. Do I have that right, Colin?
Yes, that's correct.
Yeah, so the interest that's earned in this account, is that dependent on the market, like the way it is in the 401k plan? Exactly.
Like, I mean, there is in essence a savings account feature which has a small rate of return, and I suppose that is guaranteed. But any investing that you would be doing from the perspective of choosing investment choices amongst the mutual fund choices, that comes with whatever gains or losses that there could be. Mm-hmm. Any other questions? Okay. Well, I think we'll go ahead and we'll end the call today, but I do want to just remind everyone that you are absolutely welcome to contact me with any questions that you have. Again, if you want to talk about it on a more individual perspective, you are welcome to contact me at any time. But thank you all for your time today.